Welcome to this ICF Model presentation. This can be a very overwhelming topic, and this recording is to help with your comprehension. The World Health Organization, WHO, International Classification of Functioning, ICF, Disability and Health Model, views health not from the perspective of disease, disorder, or injury, but from the perspective of how a person's health fits in with the rest of his or her life, the kinds of things the person does, and the environment the person lives in. It's a classification, not an assessment tool. Providers must complete an assessment to determine the client's needs, problems, and issues, and then the RT uses the ICF model to determine the appropriate codes. The ICF model uses a universal language approach, meaning the terms are simple to allow for worldwide comprehension and translation. For example, walking is simply called walking versus ambulation. Ideally, ICF codes are done throughout the treatment process to demonstrate progression and regression towards treatment goals. The ICF model is a holistic approach and is based on a biopsychosocial approach that incorporates all components of health described at body, individual, and societal levels. The ICF model has some key terminology. Although discussed in this presentation, you will most likely benefit from ensuring that you have completed the reading assignments associated with the model. Capacity is the term used to describe a client's ability to do a task or action in a standardized testing environment. Standardized testing environment could be a physical therapy gym. The term performance refers to the client's ability to engage in life situations. The term activity is the execution of a task or action by a client, while activity limitation refers to the difficulties a client may have in executing activities. Participation in the client's involvement in life situation, while participation restrictions are the problems a client may experience with involvement in life situations. An impairment refers to a problem in bodily function or structures, representing a significant deviation or loss. An assistance refers to the use of an assistive device or personal assistance. A barrier is something that restricts or hinders one's performance, and a facilitator is something that assists or supports one's performance. The ICF model is comprised of two parts. Part 1 is titled Functioning and Disabilities and is made up of 3 sections: body functions, body structures, and activity and participation. Body functions are coded as B codes, and this covers the physiological and psychological functions of the body. Body structures are coded as S codes and includes the anatomical parts of the body, such as organs, limbs, and their respective components. Body structures, or S codes, are not typically coded by our profession. Activity and participation are coded as D codes, and this category lists the activities that people commonly perform in real life. Activities and participation, or D codes, reflects the client's ability to do the activity, and it's typically coded by our profession. Part 2 is titled Contextual Factors and is made up of 2 sections: environmental factors and personal factors. Environmental factors are coded as E codes and refers to things within the person's environment that affect his or her health and functioning. If the environmental factor is helpful to the client, it is called a facilitator. If the factor is seen as harmful, it is called a barrier. Environmental factors are routinely coded by our profession, and they assist in demonstrating the relationship between the environmental issue and other issues, as coded E codes are often attached to D, S, or B codes. The last section is titled Personal Factors and is currently not coded as it has not been fully developed. Before we move on, let's do a little recap. A B code refers to bodily functions, body functions. An S code refers to body structures. A D code refers to activities and participation. Think doing. And an E code refers to environmental factors. Please stay with me on this topic. On this slide, we will be discussing the coding structure before the decimal point. On the bottom corner of the screen, you will see an example of an ICF code. I realize it looks like a series of numbers preceded with a letter, and you may be thinking, this is impossible. Just give me a moment to explain. We already discussed what the letter of the code refers to. Let's figure out the rest of the code. From this point forward, I want you to think of the codes as chapters in a book. So the letter represents the book sections. In this example, the title of the book would be the ICF Model. The book would be broken into 4 sections. These 4 sections are broken down into chapters, and each chapter can be further broken down into subsections, and so on and so forth. If you can visualize this book or outline setup, the coding system models this logical breakdown. It may benefit you to reference the WHO document from your assigned readings to help you visualize the format. You will find our example on page 41. I mean the 41st page of the WHO document that I've uploaded, of the assigned reading document. Rule number 1. Codes always begin with the letter of the corresponding section. As stated in the previous slides, a B code means bodily functions, an S code means bodily structures, a D code means activity and participation, and an E code means environmental factors. Rule number 2. The letter is always followed by a numeric code based on the following system. The first number after the code represents the correlating chapter or level 1. With the example given in the bottom corner of your screen, D4. The letter and the first number refers to activity and participation, movement. Take a deep breath and look at the slide. Find the activity and participation column because that is your D code. And look down the column until you find D4. This will be the movement chapter. The next set of numbers refers to functional area or level 2. This is not visible on this slide, but please look at your WHO document. Also with our example, D410 refers to changing basic body position. The next number refers to the next level of specific functioning, or level 3. In our example, D4100 refers to laying down. If there are more numbers, then there are more levels under this example. The next number will refer to the 4th level of specificity and assuming one is identified. So it would just keep going on and so forth as the chapters we whittle down. Once you have identified the code and have broken it down as far as possible, the therapist will place a decimal point to signify the end of the primary code. This slide will cover the general rules of coding after the decimal point. When doing ICF coding for a quiz or in this coursework, you will be expected to code 1 qualifier after the decimal point. In some situations, if you continue to use the ICF model in your career, we will discuss some of these situations further briefly in a moment, Codes can have up to 4 qualifiers or numbers after the decimal point. Continuing with the use of our example, D4100, you will notice that the number 2 was added after the decimal point. All numbers after the decimal point are called qualifiers because they give meaning to the limitation. Based on the information on this slide, you can see qualifiers range from 0, no problem, to 4, complete problem. You can disregard the 8 and 9. For our example, our client has a moderate problem laying down. Qualifiers can be used to show progression and regression. As the client improves, the qualifier will reduce. If the client regresses, the qualifier will increase. Without qualifiers, the codes have no inherent meaning. For your knowledge, qualifiers have differences based on which section they are referencing. You will only need to do qualifiers based on this table of this slide and the information I have already provided you. Body structures can have up to 3 qualifiers as an option, meaning that if you are reading a body structure as coded by a primary care provider, it could have 3 numbers after the decimal point. Even though RT professionals do not typically code body structures, you will want to understand the codes written by your providers. The 3 qualifiers available for body structures are the first qualifier that uses a generic scale just like the one on this slide, and the second qualifier refers to the nature of the change in the respective body structure, such as absent or deviation. The third qualifier will indicate the location, such as left or right. While dealing with activities and participation code, the provider could use up to 4 qualifiers. The first qualifier is performance and refers to what the person does in his or her environment using whatever assistance is usual. The second qualifier is capacity, without assistance, and describes the person's ability to execute a task or action without assistance in a standard environment. The third qualifier is capacity with assistance and indicates the best probable level of functioning with the provision of direct assistance in a standard environment. And the fourth qualifier is performance without assistance, meaning that the individual does what the individual does in his or her current environment without. Environmental factors are coded in the same fashion as the other sections, except instead of a traditional qualifier, you will use the table on this slide to do the qualifier. If the environmental factor is a barrier, then the qualifier is indicated with a decimal point. If the qualifier is a facilitator, then the qualifier is indicated with a positive sign. Environmental factors are almost always coded in conjunction with another code. There are examples on this slides table of what an environmental code may look like depending on whether or not it is a barrier or a facilitator. We will do coding in class to ensure you can comprehend this material. I did include an example here on how they are structured. Here is the dilemma. Patients do not talk in the language that it takes to code, and the practitioner will need to use clinical judgment when selecting the correct code. Let's use the example on this slide. Ariana has a moderate problem handling stress. When assessing Ariana, most likely she did not say, "I have a moderate problem handling stress." Most likely she said, "I struggle with stress. Not always, but most of the time. I can handle it. Sometimes." Or she might have said, "I'm so stressed out. I do yoga, but sometimes it's just out of control." Now it's the practitioner's job to decipher her words to fit into the code. I have used my clinical judgment and decided that she has a moderate level related to handling stress. I chose moderate because sometimes she can handle it and sometimes she cannot. I have included the correct code based on the information I have provided you. If you look up D2401.2, you will see it refers to handling stress, and the number after the decimal point indicates a moderate level. Also, distinguishing codes can be challenging. For example, bodily functions has attention functions with a subcategory of sustaining attention, referred to as B140. And in activities and participation, there is focusing attention, D160. The therapist will have to decide which is most accurate. In other cases, some codes appear to overlap. For example, conversations versus discussions, or appetite versus craving versus weight management. Using clinical judgment to select a code you feel best describes the behavior or issue you will be targeting with your treatment is essential. Codes can be used to understand the targeted areas of other professionals. For example, if a client has already been coded by the attending physician or another treatment team member, you can use the code to gain understanding of the individual prior to completing your assessment. If coded correctly and often, it will demonstrate and document progress and regression of the client. We will be practicing coding in class. You will want to have access to your WHO document or the ICF coding website in order to determine which code is best or most accurate. You may want to have access to the PowerPoint version of this presentation in order to have easy access to the primary chapters and qualifier scales. I hope this presentation has shed some light onto the ICF model and the coding process.